So my dear friends, we can start from the pathogenesis of T cell mediated cytotoxicity. Cytotoxic T lymphocytes cause destruction of antigen bearing target cells, particularly the tumor cells and the virus infected cells, through activation of apoptosis by either the activation of the FAS system or perforin granzyme dependent killing. So the examples of type 4 hypersensitivity include tuberculin reaction, lepromin test, multiple sclerosis, chronic graft rejection, contact dermatitis, sarcoidosis, type 1 lepra reaction, tumor immunity, resistance to viral infections. So here we can discuss once more about the autoimmune disorders. So here in this diagram there is diseases, autoantigen and the pathology. We can start from systemic lupus erythematosus. Systemic lupus erythematosus is an autoimmune multi-system disorder of unknown etiology, more commonly seen in the females in the age of 20 to 30s. The deficiency of early complement proteins C1, C2 and C4 has been associated with increased incidence of SLE. The clinical criteria for the diagnosis of SLE include any four of the following. So please remember the clinical performance will be malar rash, discoid rash, photosensitivity, oral ulcer, arthritis, serositis, pleuritis or pericarditis, renal disorder, hematological disorder, immunological disorder, antinuclear antibody, neurological disorder, seizure or psychosis in the absence of known drug or metabolite abnormality. The organ development, and it may involve in the organ involvements. The involved organs are kidney, heart, oral cavity, joints, skin and blood. So from the diagram you can clearly saw the genetic mutations, which includes HLA, DR and interleukin 10 and IRF14, 5 complement genes, and from the ultraviolet light, because it will be having the photosensitivity. So please write down the more details from this diagram. So we go for the next one, Sjogren syndrome. Sjogren syndrome, it is an autoimmune disorder more commonly seen in female, characterized by the destruction of lacrimal and salivary glands, resulting in the inability to produce tears and saliva. It can be primary when it called Zika syndrome, and it may be secondary rheumatoid arthritis most commonly. These patients are at increased risk of developing lymphoid malignancies. There is presence of anti-ribonucleoprotein antibodies like SES-A and SES-B. The presence of dry mouth, xerostomia and dry eyes, keratoconjunctivitis, Zika. Mukulic's syndrome include lacrimal and salivary gland enlargement of whatever cause. The next one, mixed connective tissue disease, MCTD. The coexistence of features suggestive of systemic lupus erythematosus, polymyositis, rheumatoid arthritis and systemic sclerosis. Antibodies to RNP particle containing U1 RNP. And the next autoimmune disorder we can discuss here is Scleroderma. The skin is most commonly affected. Diffuse scleroderma is characterized by presence of anti-DNA topoisomerase antibodies SCL70. The symptoms include dysphagia, malabsorption, arrhythmia due to cardiac fibrosis, exertional dyspnea, and renal insufficiency. Limited scleroderma is characterized by presence of anti-centromere antibodies. Patients develop CREST syndrome, calcinosis, Raynaud's phenomenon, esophageal dysmotility, sclerodactyly, and telangiectasia. X-linked agammaglobulinemia of Brugge. So scleroderma is very important disease, and it's affected by the autoimmune disorder. The skin is the most commonly affected. Diffuse scleroderma is characterized by the presence of anti-DNA topoisomerase antibodies. The symptoms include dysphagia, malabsorption, arrhythmia due to cardiac fibrosis, exertional dyspnea, and renal insufficiency. Limited scleroderma is characterized by the presence of anti-centromere antibodies. So please remember this point. It is the limited scleroderma is characterized by the presence of anti-centromere antibodies. Patients develop CREST syndrome, which includes the calcinosis, Raynaud's phenomenon, esophageal dysmotility, sclerodactyly, and telangiectasia. They are mostly X-linked. So in Sjogren syndrome, the symptoms to never ignore: brain fog, fatigue, chronic cough, vaginal dryness, dry eyes, dry mouth. No matter how much water you drink, so it will be always dry. Dental problems, swollen glands, aches and pains in joints such as fingers, wrists, ankles, dry, itchy skin, numbness, or other nerve problems. The precursor B cell or B cell tyrosine kinase, mature B cell. It is an X-linked immunodeficiency disorder. So here we are discussing about X-linked agammaglobulinemia of Brugge. It is an X-linked immunodeficiency disorder characterized by mutation of B cell tyrosine kinase. The disease is in almost entirely in males. B cells are absent and the serum cells of all classes of immunoglobulins are reduced. There is absence of plasma cells, but the T cell mediated reactions are normal. So the next topic is Viscote Aldrich syndrome. They are X-linked recessive disease characterized by thrombocytopenia, very low platelet count. Maybe eczema, immune deficiency, and blood diarrhea secondary to the thrombocytopenia. So in these people the bleeding problem will be very high and blood clotting will be very difficult. So they will having the blood diarrhea. Typically immunoglobulin EM, IgM, they are millionaire's body, also known as, please remember, they are also the immunoglobulin EM is also known as the millionaire's body, and they are present mostly they are present they're present very their size is very big, and they are one second my friends. So Viscote Aldrich syndrome, typically immunoglobulin, their immunoglobulin EM levels are low, IgA levels are elevated, and IgE levels may be elevated. So please remember the IgM, they are responsible for the primary immune response, and they are having the maximum molecular weight, maximum size, present as the pentamer, and immunoglobulin EM is also known as Meniere's antibody. And the next one here, IgA levels are elevated and the IgE levels are also elevated. So what is IgA? They are recent in physiological secretions of the body. They are present in dimer form joined by J chain. And IgE are the allergic response for the allergic conditions. They are increased and they are homocytocropic antibody. The treatment of the disorder is done by bone marrow transplantation, that is IG or splenectomy, IVIG or splenectomy. So we can discuss the next topic, DiGeorge syndrome. It is a T-cell deficiency due to failure of development of the third and fourth pharyngeal pouches, resulting in the absence of the parathyroid glands and the thymus. The patients have a loss of T-cell mediated immunity owing to hypoplasia or lack of the thymus, tetany owing to lack of the parathyroids, congenital cardiac defects and abnormal facies. We can discuss the next one, amyloidosis. It is a group of disease having in common the deposition of the amyloid, a pathologic proteinaceous substance deposited between cells in various tissues and organs of the body. So what is amyloidosis? It is a group of disease having in common the deposition of amyloids, a pathological proteinaceous substance deposited between cells in various tissues and organs of the body. Amyloid is seen to be made up of non-branching fibrils of indefinite length and a diameter of approximately 7.5 to 10 nanometer by the electron microscope. The classification of amyloidosis. Primary amyloidosis, as it is associated with immunocyte dyscrasias like multiple myeloma or any other B-cell neoplasm. The chemical nature of the amyloid is Al. For light chain. And in about secondary amyloidosis, also called as the reactive systemic amyloidosis, it is usually seen secondary to chronic inflammatory conditions like rheumatoid arthritis, most commonly tuberculosis, bronchiectasis, chronic osteomyelitis, inflammatory bowel disease, ankylosing spondylitis, and two cancers, renal cell cancer and Hodgkin's disease. Hemodialysis associated amyloidosis. It is caused by the deposition of the beta-2 microglobulin, which cannot be filtered through the coprophene dialysis membrane. It gets deposited in the synovium, joints and the tendon sheaths. The chemical nature of the amyloid is A beta 2. Heredofamilial amyloidosis. Their familial Mediterranean fever is an autosomal recessive condition characterized by the development of attacks of fever. The amyloid protein deposits is AA protein and the protein associated with the condition is called pyrin. The familial amyloidotic neuropathies. There are several types. This is group of autosomal dominant conditions in which both peripheral and autonomic nerves are involved. There is deposition of mutated ATTR, A for amyloid and TTR is for transthyretin, a protein which transfers thyroxine and retinol. The transthyretin deposition in this condition. Systemic senile amyloidosis. This is a condition characterized by the deposition of structurally normal transthyretin. The chemical nature of amyloid is ATTR and it is usually deposited in the heart of aged individuals, leading sometimes to the development of restrictive cardiomyopathy. localized amyloidosis, Alzheimer's disease. Chemical nature of amyloid is A. Beta. Medullary carcinoma of thyroid having the deposition of A. cal derived from calcitonin. Islet of Langerhans. Type 2 diabetic mellitus having deposits of APP derived from islet amyloid peptide. We can see the morphology in amyloidosis. The kidney is affected. It is the most common and most serious form of organ involvement. It can lead to increased size of the kidneys. So the nephromegaly is involved. Spleen. There is splenomegaly. If there is involvement of splenic follicles, it can also increase the size, and it is called sag of spleen. And if there is involvement of splenic sinuses and a red pulp, it is called as Lardaccious spleen. The liver. It is first deposited in the space of Disse and later result in hepatomegaly. The liver function tests are usually normal. Skin. It can lead to development of pinch purpurae. In the heart, it is more commonly associated with primary amyloidosis. It is the most important organ involved in senile systematic amyloidosis. In the gastrointestinal tract, may be involved through the gingiva to the anus. The deposition of the amyloid in tongue results in the nodular enlargement of tongue called macroglossia. And in the joints, deposition of the amyloid in long-term hemodialysis takes place in joints and the carpal ligament of the wrist, the later leading to the development of carpal tunnel syndrome. And the diagnosis made by the microscopic examination of the biopsy from renal tissue, rectum, abdominal fat aspiration and gingiva. The abdominal fat aspiration is the best way of diagnosing this condition, but has low sensitivity. The rectum is the best site for taking the biopsy. Grossly, the organs are having a waxy appearance. The cut surface on painting with iodine imparts a yellow color, which on application of sulfuric acid gives a blue-violet color. The staining of amyloid, it is Congo red. It imparts a pink-red color under normal light microscopy, whereas the amyloid gives an apple green preference in the polar side. So please remember, in amyloidosis, in the normal light microscopy, it's like a pink red color appearance. It is Congo red. Thioflavin T and ES give secondary immunofluorescence with ultraviolet light. The metachromatic stains like crystal violet and methyl violet. Amyloid is PAS positive.